to the Build Health International Sustainability Podcast. My name is Fatlum Troshani, also known as Lucky. I'm the Senior Structural Engineer with Build Health International, and today I'm joined by Jose Mataix. He's our Electrical and Renewable Energy Systems Engineer. Today, we're going to be talking about one of the key aspects of BHI's work, and probably one of your favorite topics, Jose, renewable energy. For a bit more context, Build Health International is a design and build nonprofit organization. Our mission is to give access and build healthcare infrastructure in complex settings. With that being said, Jose, why don't you give us a bit of introduction about you and the role you do at BHI?
Sure, Lucky. Yeah, thank you for the introduction. Well, like you said, I'm an electrical engineer that has been working with renewable energy systems pretty much from the beginning of my career. I was probably working for about 10 years at the private sector back home in Spain. And it was around 2015 when I came across this job offer from Build Health International. I was working as a freelance engineer back then, just doing independent consultant work. And I just figured out, okay, I'll reach out to these guys and see if there's a way for me to help them. I wasn't thinking about like joining full time BHI back then, but yeah, that's how I engage with BHI's work, and until today, just 10 years later, here we are.
Well, that's a lot, and we've both been at BHI for about the same time. You started a little bit before me, but having pioneered some of the early work with renewable energy systems at BHI, can you maybe speak a little bit more about some of those early days and your involvement as well?
Sure, yeah. Well, like you said, I think it's always been very clear for Jim and for the whole BHI crew that renewable energies were like a key aspect of the work we do, BHI does, because they saw from the very beginning that access to energy was like a big challenge, and especially affordable and reliable energy. And they saw that solar and like renewable energies in general was like a great way to improve this access to energy. So it's actually impossible for me not to talk about HUM, which was like the first project and probably is the flagship project, renewable
Mm.
energy project for BHI. So it was, like I said, in 2015 when I first like reached out to BHI, and they gave me the opportunity to start working with them in like originally as a freelance consultant. That was the biggest project and probably the only one that we had on the table at the time. And basically, when they built HUM back in between 2011 and 2013, they had originally designed and built this grid-tied solar system that was designed, like I just said, as a grid-tied system, and that was based in the understanding that the utility was going to be reestablished sometime after the earthquake, and that's actually what was given to understand that the government was working with some international support to reestablish the electricity supply, especially at the Central Plateau
Mm-hmm.
where AUM is, and that's how they ended up deciding to go with a grid-tied system, a solar grid-tied system, because utility was going to be available. So that was the easiest and cheapest way to support
Mm-hmm.
HUM with solar generation. The reality was that 3, 4 years later, the utility wasn't as stable as it was supposed to be, and it became a real challenge to be able to use that system. And that's when we had to get creative and figure out an alternative way to use that system that again it had
Yeah.
been installed, it was there, but it wasn't being used because the utility wasn't really available.
And that's
um,
public utility, meaning coming from
yes.
the city.
Yeah, yeah,
I see.
that's EDH, which is Electricité d'Haïti, which is the
Mm-hmm.
only utility company that is basically a national
Yeah, yeah.
company. Yeah,
Interesting. Yeah.
yeah.
And definitely an interesting project to jump to get introduced to BHI for you, I think. And but a lot of work has gone into that, and from your end specifically too. So it's a great project.
Yeah,
Um,
absolutely.
yeah, but I'm sure as you started to allude to some of the challenges that you're facing, whether it's the lack of consistent utilities coming in to the hospital, serving the hospital, but what are some other challenges that when designing renewable energy systems, whether it was specifically to HUM or other projects that you've worked at BHI, like how does that? What are some of those challenges that you're facing?
Um,
Um,
well, where do I begin? Like, HUM, yeah, again, that was kind of like that's like jumping right into it because it's a really big project and it's in Haiti, which is like a very
mhm,
challenging setup. But like most of the places where we work, challenges that I could list. So we could go all the way from the technical challenges, which is working in an environment where, again, power, at least utility power, is like really unreliable, very
mhm,
unstable. That's even sometimes like it's not available. So
yeah,
you're just working in an environment where utilities is not an option. Um, and yeah, we could go from these technical challenges all the way to the logistical challenges, just like working in places where, again, I was coming from the commercial
hmm,
industry, right, where you just have like all the supplies available, you have all the professionals that you need, and like all the tools and equipment that you can need for any project, and that's definitely not how it is in Haiti or like in any of the countries where we work in Africa. So and that's something that definitely impacts the way you design and you implement projects, right?
right,
So for me, it was like definitely a big change and a continuous challenge. First, figuring out the how to face these technical challenges, and then planning around all these logistical challenges that we knew we were going to find during the implementation. And that's something that I had to learn through the process of like working on the first projects. And I have to say that we keep learning every day because
yeah,
like something about this the places where we work is that they are always going to have like some like surprises for you, even though you think you already found all the challenges. There's always something
something
to
new,
learn. Yeah.
yeah. You spoke to some of the logistical challenges. What are some of can you maybe elaborate a little bit more, like whether logistical needs or how does a so like one of the questions that may come up is like how does a solar panel make it from like the design side, yeah, and all the way to getting installed, and what does that process look like from your perspective?
Well, so the main difference is, working back home or here in the U.S. when you are just designing a project, you specify your solar panels, you're just gonna buy them, and you just basically provide the delivery address, and you don't even need to worry about that process because
Right.
there is already a system in place that is just going to,
Mm.
provide that your panel gets from the
Make
purchase
sure that
point
right.
to your job site. Well, that's not the case for us in any of the sites where we work because BHI actually needs to take care of this whole like procurement and like transportation
Shipping.
process.
Hmm.
And as you can imagine, it's gonna be like very tricky. I can think, for example, of other projects like the one we did in the southern peninsula in Fond de Blanc in Haiti, where the roads are just dead roads for the last probably, I don't know, like 30 40 miles, and these are roads that get washed out every time that they have like one of these like big tropical storms. So you just need to like, and it's not only solar panels, it's we're talking about like very heavy batteries, right, or like very large pieces of equipment like inverters,
Hmm.
solar racking. It's a lot of materials that we need to transport, and you need to start thinking about like all the problems that you can find like along the way. Again, we're just like moving trucks through like very very like deteriorated roads. So you need to think about like all these things, like how are we
Yeah.
gonna split these materials, like which company are we gonna be hiring, like is there a company that we can hire, maybe we need to figure out the logistics in-house and use our own like vehicles if we have them. So it's like again like very challenging, and you also need to think about things like some of this equipment is going to get damaged or lost during the transportation, right?
Hmm.
So back home, you don't need to worry about that because they will just replace it, or there's like an insurance
Sure.
company that
Right.
is going to take care of that. But that's not the case for us. And then we are always obviously working on a very tight schedule, and we are also trying to get the right professionals on site to do the work. So
Hmm.
if you're missing a critical piece of equipment that is going to like
Affect the
affect
schedule.
the whole schedule of the
Right.
project. So you need to like come up with all these contingencies that are gonna cover like all these potential issues that
Right.
you know could happen
Yeah, all
in
those
these places.
challenges that keep
Yeah,
surprising you. Yeah,
yeah, yeah,
that's very interesting. It's very interesting. Like just laying it out to and understanding some of those challenges with logistics and the responsibility that BHI takes on and some of the scope of work that BHI covers with having to do the procurement, the shipping, um, and making sure that it gets on site in time
yeah,
for the technician to install and get it commissioned and have it running properly.
yeah. And I guess I just mentioned like the most like practical issues, but then we have to deal with all these other situations, like the situation that unfortunately we had to deal in Haiti
Yeah,
with the last two projects where political the political situation is like very challenging, and all the social unrest. So that includes just like a bunch of additional factors that you need to consider because
right.
like it's really insecure, like moving materials around, and even just like something that really concerned me during, for example, the implementation of the last two projects, which was the phase two of A2M, or the implementation of the like expansion that we did for this hospital in the southern peninsula
Hmm.
in the Fond du Plan area, was moving our crews around, right? Like
Right.
it's like that it's very unsafe,
Safe.
and you need to just like very carefully plan around the timing and
Hmm.
the routes that you are going to be using
Right.
to move your crews. So like that was like extremely complex work, like for the whole team, right?
Yeah.
For us and for the project manager and like our logistics team, just to like come up with the best ways to keep everybody safe and just like get them to the job site on time and in a safe way. So
Yeah.
that was like same thing with materials. Again,
Right.
like we were exposed to be like losing materials anytime.
Yeah, that's interesting. And one other question that comes to mind too is around some of the financial considerations, whether it's as an organization, BHI, but working with our partners too, how we think about that when it comes to designing and implementing renewable energy systems.
That's like probably that's one of the key factors that we have to consider when we are designing a solar system or a microgrid system
Hmm.
for one of these facilities, because at the end of the day, that's one of the well, there's several advantages that installing a microgrid system provides. The first one is power stability in terms of like both reliability and quality. Like one of the biggest challenges that all these facilities are facing is the uncertainty of like when power is going to be available, and then the quality of this power, right? So providing consistent power and high quality power, it's probably two most obvious advantages of installing these renewable energy systems, right? Because like I just said earlier, utilities are very unreliable, and also the quality of the power that they provide is like very low, right? So that, and I just went back to this. I know you asked for the financial aspect, but I'm just like bringing these
No, it's
two
okay. This
because
is great.
actually
I'm
it's
interested.
related to that, because like many times we our partners came to us, or like I could say that even like originally Jim and the whole team, they realized very early on that solar and renewable energies were like gonna be like super helpful to like make the work of all our partners in these environments successful, because
And sustainable too, probably.
and
Make sure
sustainable too. Exactly.
ensure that the hospitals continue running and have the energy they need to run the equipment and the operation side.
Correct. Yeah. And so maybe the best way to break this is like I see like the four main factors here are number one is going to be sustainability in terms of like of operations. The second one is going to be the I could say reliability of the system, and the third one could be here the financial factor, and then
Hmm.
there is also the environment factor,
Right.
right? So when I talk about like the sustainability is like I said, like it's very common that power quality is very low in these places, and that's actually having a direct impact into the equipment. Like it's very common to see how these facilities are constantly losing equipment as a consequence of the low power quality, and
Damaging the
yeah,
equipment.
damaging like
Right.
very expensive
Yeah.
biomedical equipment. So that requires already that's impacting into the financial
Financial
piece,
side.
right?
Right.
Because they're losing all this equipment that either needs to be replaced or fixed. So
Hmm.
by providing a higher, more stable power, higher quality, more stable power supply is going to help like save a lot of money on that side, right? Because
Right.
you're not going to be losing that much equipment. You're not going to have to be constantly fixing it. And then when it comes to the sustainability of the like healthcare services that they are providing,
Hmm.
it has a huge impact because like I can't imagine like just how many times there was like maybe like even a surgery that was scheduled and it had to be canceled because like a very critical
Right.
piece of equipment wasn't available or power was not reliable enough, so
Right.
they could not really trust the equipment that they were operating to
Hmm.
actually get into this very critical procedure because they didn't know if power wasn't going to be like
Right.
reliable enough, right? So and just like trying to kind of like round this up is like number one, you have this way in which having poor energy quality is impacting the financial aspect because you're
Right.
losing a lot of equipment. But then, if we try to analyze the way they are producing energy in these places, which implies many times diesel generation, that means that the cost of energy is going to be very expensive for these facilities.
Hmm.
So producing energy with solar systems is just going
Yeah.
to really help cut the cost of the of the electrical generation.
Great. We've talked about quite a few challenges, number of challenges, but what about the successes? Like, what are some of the projects that you're most proud of? The different types of projects that you may have worked on as well. But what comes to mind when you think about successful sustainability and renewable energy projects?
So for me, the best way to actually sense the success of the solar projects we've done is just going back to all the projects we did like a few years ago and see that these systems are still operating. Because
Mm.
unfortunately, one of the things that we find like very often when we, you know, we're traveling and just doing the assessments that we are doing for all our partners, or when we're installing these systems, I can't count the number of times that other partners came to us because they heard like, oh, this like the BHI crew is now doing an assessment or they're installing
Right.
this system at this facility, and like people from other facilities would come just like looking for us because they had this solar system that was installed 3 years ago and is not really operating, like asking us if we could stop by and take a look and see if we could figure
Fix
out
it.
like what was the problem. And of course, if we had the time, we didn't, unfortunately we didn't always have the time, but that was actually a great learning opportunity for us every time
Mm.
we did that because you start realizing that installing a solar system, it's it's something that is it's not rocket science. It's not something super complex. But when we are designing this back home in the U.S. or in Europe, there's all these factors that are gonna come up that we didn't think about, but are gonna render these systems unusable after a little time for reasons like not having the right trained personnel to do maintenance or to do the proper monitoring of the system, maybe sometimes just not having access to the right parts to like repair some of this
Yeah.
equipment. So that's something that sometimes just like you don't think about it when you're designing a system that is going to be installed in a setting where you have easy access to all these things, but it's something that is gonna be like critical to keep all these systems running. So to me, just and I think I can probably say this, that if I go back to any of the systems that we've installed today, and that goes all the way back to 2015, they are all running today, and that's because when it you know that comes to the design phase, is you need to like very carefully keep that in mind and consider that you're picking the right equipment in terms of like knowing that it's going to be equipment that can be like relatively easy to maintain,
Mm-hmm.
that it's going to be relatively easy for the facilities teams of all these hospitals and clinics to have access to the spare parts that they are going to need
Right.
for to the maintenance, and also choosing the right. Even this goes all the way back to the manufacturers that we are choosing, because you need to make sure that they either can provide technical assistance on these
Mm-hmm.
places, that they have the capacity to provide remote support, or they even have like local partners, whether it is
Right.
in the Caribbean region or in Africa, where all these clinics and hospitals can like go to whenever they have an issue. Because
Mm-hmm.
again, like as any system is gonna, it requires a maintenance, and it's a matter of time before there's an issue,
That's true.
and
Right.
it requires an intervention. So like planning very carefully around these things, I think
Uh,
is critical. So to me, again, a successful project is that project that we just like follow up with the partner a few months, few years later, and it's still
it's still,
operating.
it's
Or
still
the
operating.
partner reaches out to us because they go, "Oh, system just went down." It's like, okay, that means that if you just reach out two
Right.
years later, is that it's been working for these 2 years. Now you have an issue, nothing that it wasn't unexpected.
Right.
Let us see how we can help you, and just like get the system up and
Yeah.
running again as soon as possible. So that could be that's again to me the main way to measure the success, and like I said, that goes mostly back to the design phase, and there's a second critical component here, and it's not only making the right decisions when you are designing the system, but also making sure that you plan for creating capacity in this like in the team that is going to be
Right.
operating that system, right? Because it's something that needs to be like constantly monitored, right? And you need to create this sense in the partner in
Mm-hmm.
like the team that is running this clinic or this hospital, that it's a system that they need to like be constantly monitoring
Right.
and maintaining, and they kind of like
Yep.
creating this sense of like preventive maintenance and
Mm-hmm.
or like proper planning in terms of budgeting, or for them to just like
Yeah.
create the capacity in their own teams to be constantly monitoring these systems.
And that must include a lot of training, like beforehand, and that, like you're saying, sort of the culture in the organization that operates these hospitals to budget and plan for these preventative maintenance
Correct. Yeah,
stuff.
it's a lot about training, but also a lot about like making sure that they understand that they need to retain this capacity, because training
Mm-hmm.
is gonna create this capacity. Then they need to also like
Retain.
retain it,
Right.
and
Right.
plan for the future to just like build their teams in a way that this capacity stays within the facility or within the organization that runs these systems.
Great. I have one final question, and you kind of led me to it in a way of around the future of some of the projects that are up and coming, and what is BHI's future around renewable energy, and how you see that as well.
So I see it as I could say a huge opportunity for VHI, because fortunately I think the awareness of the importance of installing these kind of systems is just like growing, and it's becoming more obvious for all, I could say, governments and organizations that run these hospitals in all over Africa and the Caribbean, that having these renewable energy systems is actually going to be extremely helpful for them in terms of I mean financially, it's just gonna help them to provide a much cheaper energy.
The technology too has changed and has progressed in a way that has made it become more affordable and available.
It has, yeah,
Yeah.
definitely. Like, just for example, like I said, going back to 2015, which is when I started working with BHI, compared to today, for example, the price of a solar panel is probably a third today of
Wow,
what it was to be 10 years
it's
ago,
a huge
right?
difference.
But then when we are looking at some other key components of these systems, today we are installing like very large lithium-ion batteries, which were not really available back in 2015. It was something really new, and they were
Hmm.
definitely not available at this larger scale. We're basically using different technologies, mostly lead acid, and
Hmm.
those batteries were like actually they had shorter life. They were like a lot more sensitive to higher temperatures or like the lack of maintenance.
Yeah.
And so today, 10 years later, we have access to these batteries, lithium ion, for example, which are like way cheaper than they were back then, and they are like way more reliable. So that's just an example, but I'm sure that probably in a few years from now we'll be probably talking about this different
Yeah.
storage technology or like generation
I'm
technology.
sure
Who
you're
knows?
keeping an eye on that. How
Yes,
it's
that's something that,
progressing.
well, that's is part of our job. Just keep an
Right.
eye on like how the market is evolving and like what's just like what's new and
Right.
what can be applied into like these projects. We also need to do it very carefully because like as new technology comes available, it's not like it's not always smart to like use it in these settings, right?
Right.
You need to give it a little time, make sure that it gets proven, and then after a few years
Right.
is when you can think about like implementing
Mhm.
them in these setups again, because like access to operation and like well access to maintenance, proper maintenance and like
Yeah.
spare parts, it's
It's
always gonna take longer in
right.
these setups.
Well, thank you, Jose, for this really great conversation. I learned a lot about the work you do, the amazing work you do at BHI. This is a very exciting conversation. To wrap it up, to everyone else who is interested in learning more or connecting with the BHI team, with Jose, find us on LinkedIn, connect with us via website. We also just launched our annual report. You'll see a lot of highlights of some of the recent project work that we've done this past year. And with that, thank you very much.